everyone is using AI models now to see whether their doctor is correct or not.
We all know AI is artificial intelligence. But what does it mean really?
It's essentially how mathematics and computation meets medicine. We are trained essentially to look at different patterns, how a patient presents to us. We learn from textbooks. What AI does is essentially figures it out on its own. And that is why we are calling it an artificial intelligence. Anyone who is interested in AI wants to give a little bit of time to learning about AI and to implement this as a first adopter will definitely be able to leverage AI as a tool, improve their practice, and also really see the benefits of AI in the years to come.
As of today, there is not one single model which is it's not one shoe that fits all.
Not at all.
So does one kind of learn this also by trial and error? Or how do you know which is the chatbot or the chat engine or the AI module that is best suited for myself? So I'm sure for you, transitioning from radiology to AI must have been a natural progression.
While my residency was happening, we developed AI models and we did do a lot of great model development evaluation, and we also won international awards. But I realized gradually that it's not just going to be imaging. There's so much data of a patient, imaging, clinical notes, your genomic profiles, and even your wellness data from your sensors. GPUs are essentially graphical processing units, and we all know NVIDIA is today a $5 trillion company. The reason why it has really come into the forefront is because the GPUs which they make allow you to do the kind of mathematical computations which a CPU does simultaneously. And in the next couple of years, I think the field will be very mature and we will be seeing a lot of AI models being used by you and me in the clinical practice. We often try to really show it to people that you cannot trust AI fully, and your doctors are much more worthy of your trust than your AI chatbot on your phone.
No country's laws have been able to keep up with the technological advancements. What if, as a doctor, I depend on AI and I misdiagnose a patient and the patient is able to prove that the fault was with AI?
There's a big hospital in India which is already running an autonomous AI model for chest X-ray report generation, which actually
Welcome to Top Tales, a podcast with a difference. This is a podcast where we not only influence your present, but also help you reshape the future. Today we are going to talk about a very interesting topic. It is something which is a part of our life already. We never understood when it crept in through our back door, when we started using it. What am I talking about? Well, I'm talking about AI, or artificial intelligence in the field of medicine. What is AI today for a doctor? Is it a teammate, somebody you can bank on? Or is it a threat? Is AI here to replace you as a doctor? Is it going to take your patients away? How are you going to deal with it? Is AI going to make me more dependent on it? And is it going to be a downhill journey? Or is AI going to enrich my life? And today, for our guests, we have none other than Dr. Suvrankar Datta. Welcome, Dr. Datta, to Top Tales, a podcast for doctors. Dr. Datta is a leading researcher into the field of AI and its implementation in medicine. A radiologist by profession, he has wholeheartedly devoted himself to research into AI and medicine as a whole. I welcome you again, and let's get started with this episode of Top Tales.
Thank you so much. It's my pleasure to be here.
So, Dr. Datta, when we start this podcast now, we are going to really dumb it down for people. We are going to talk to doctors who are just passing out from their graduation, to doctors who've been practicing for more than 20, 30 or 40 years.
Right.
So let's start with the absolute basics. Can you just tell us, we all know AI is artificial intelligence. But what does it mean really?
Right. So if you look at artificial intelligence, it's not magic. It's essentially how mathematics and computation meets medicine. When a doctor is trained, we are trained essentially to look at different patterns, how a patient presents to us. We learn from textbooks. What AI does is essentially figures it out on its own. If you look at traditionally, when computers started coming up, we had rule-based systems. So we taught if this is present, then you reply with this particular answer. Now we are feeding the computer huge amounts of data, everything regarding the patient, everything regarding your treatment protocols, and then we allow the computer to understand from there itself without us training it or explicitly mentioning the reason why we are asking it to do something. So the computer figures it on its own, and that is why we are calling it an artificial intelligence. We are not teaching them anything, but it is figuring it itself, just like how we are ourselves training for treating our patients.
Now, before we take this further, I would just like to first talk about your journey in AI. Well, you are a radiologist, so automation and machines and softwares and algorithms are part of your daily life. So I'm sure for you, transitioning from radiology to AI must have been a natural progression. But can it be so for doctors from other specialties or doctors who are just graduates? I mean, is transition from their single specialty or graduation to AI as easy for them as it was for you?
Right. To be very honest, my journey into AI did not begin after or during my radiology residency, but it's far back when I was an undergraduate student at JIPMER in 2017, and we were building medical devices along with IIT Madras. And initial exposure of myself and my team to artificial intelligence was not in imaging space. It was rather in predicting patients who would be non-compliant to tuberculosis drugs. That was, I think, almost 10 years back. And once we are into AI, we all realized that this is just going to disrupt the practice of medicine. And in fact, that is when I started looking into this in a very deep dive manner. And I went into the depths of AI, tried to understand more. And then when I joined my residency in All India Institute, I decided that radiology was the most important thing where I would want to be a part of, because AI at that time was very imaging focused, right? And already radiology has a lot of data, which is the essential ingredient for building AI models. While my residency was happening, we developed AI models, and we did do a lot of great model development evaluation. And we also won international awards. But I realized gradually that it's not just going to be imaging. There's so much data of a patient, imaging, clinical notes, your genomic profiles, and even your wellness data from your sensors, which you are wearing today. And all this multimodal data plays a very important role. So imaging, while it helped me move into AI fully, I feel that there are so many different verticals of AI which are there, and I'm sure we'll discuss it today, that anyone who is interested in AI wants to give a little bit of time to learning about AI and to implement this as a first adopter will definitely be able to leverage AI as a tool, improve their practice, and also really see the benefits of AI in the years to come.
So put it in a nutshell, you don't really have to be a radiologist or somebody with a bent of technological mind to delve into AI. You could just be a medical graduate and yet you could, delve into AI.
Absolutely. In fact, a lot of the clinicians and medical students whom I work with are not radiologists. So, I lead a lab at the Ashoka University currently. It's called the Center for Responsible Autonomous Systems in Healthcare, where we're trying to essentially help people augment their practice and their workflows with AI. We work with almost 80% of clinicians in the lab, and most of them are not radiologists, but they have the interest of really using AI, knowing a bit more about AI, and also to implement AI in their regular either medical education as a medical student or practice as a clinician.
Okay. Now, we've been hearing about AI for a very long time now. We've had this scaremongering about AI for years together. But it is only in these last couple of years that I am seeing suddenly project managers, bankers, engineers, and to a small extent doctors who suddenly feel threatened about AI. Now, AI was there in the background for a long time, but it was never a part of our life as such. So what has changed? And now we suddenly see these mushrooming of multiple AI bots, as you may call them, or engines, as you may call them. That what has changed in the last maybe 2, 3, or 4 years that has suddenly brought AI to the forefront and into everybody's mobile or living room?
If you look at the history of AI, the background architectures which initially started the AI boom, as we call it, the neural networks, they are really old. They are like almost a couple of decades back. People in India were working on neural networks. I know people who had started doing reinforcement learning in the 1990s.
Mm-hmm.
The reason why it has suddenly boomed is that the computation power is now become democratized, and the computing power which has increased tremendously in the last couple of years or the last decade, to be very exact, along with newer breakthroughs like huge amounts of data, annotated data like ImageNet, and the newer architecture from Google like transformers, and finally foundational models which we are seeing like ChatGPT. These have come out recently solely powered by the computational power which has become available to everyone, and now it is becoming really democratized with you and me having access to really powerful GPUs in our phone itself. So this has actually led to a lot of researchers working in the space, and every single day a new breakthrough comes in, and this is the power of community-driven research, which is again happening because of the ease at which we can build this really powerful algorithms just by using a small chip on your phone.
I think that's a lot of tech-heavy talk that's going on. But again, to get back slightly to basics, as I understand it, that we have a tremendous leap in the computational ability today that has suddenly brought AI to the forefront. But then nowadays, when we start reading on newspapers, online chats, or different fora, you suddenly get bombarded with these terms like GPUs and TPUs and server farms. And what are these? Can you just, in a nutshell, tell us what these terms mean?
Right.
And how AI works because of these terms?
So if you look at computers, right, everyone knows what CPU is.
Right.
GPUs are essentially graphical processing units, and we all know NVIDIA is today a $5 trillion company,
Yes.
and the biggest company in the world, and they are predominantly the largest makers of chips, right? And the reason why it has really come into the forefront is because the GPUs which they make allow you to do the kind of mathematical computations which a CPU does simultaneously. So just imagine like 1,000 or 10,000s of similar algorithms happening side by side in a single processing unit. So this is what GPU enables you to do. So this helps us in training the algorithms with the huge millions of data points which we are throwing at the computer, and these chips help them in building those algorithms. So that is why we are seeing GPUs becoming such a common word, and everybody rushing to build GPUs, acquire GPUs, and build the data centers. TPUs, in fact, so I'll tell you, like, TPUs were something which Google created called tensor processing units. And it was essentially to help in doing really fast computation. So TPUs are really fast at mathematical computations.
So if I may cut you, how different is a TPU from a GPU?
So at this point of time, GPUs are more on the inferencing side, but that will be a very layman term. TPUs is something which Google had come up with, which was essentially allowing them to do a lot of the computational work which was required. GPUs are much more broader with respect to the utility which they have. I mean, I can't go into the technical details here, but overall.
Yeah.
In fact, if I talk about inferencing, so when you train a model, that's the training part. When you are, let's say, talking to ChatGPT, you are doing the inferencing, right? So for that particular aspect, there are newer chips coming out, like LPUs, right? So different companies are now building different kind of chips for different parts of that AI algorithmic work which is required. So I think this will become even more and more diverse, the units, and gradually we will figure out ki even better units than GPUs or TPUs will be coming up from all parts of the world, and hopefully from India also very soon.
Good that you throw up a term, ChatGPT. Now today when you look at the so-called market of AI, we get bombarded with different terminologies. ChatGPT is one, Gemini is another, Grok is there, Perplexity is there. So what are these in essence? And how does one decide which one serves you the best?
If you look at the market of these chat GPT kind of algorithms, let's call them AI chatbots, right?
Okay.
Different companies are building different AI models, which is a really large model like a GPT-4 for OpenAI, or let's say Claude for Anthropic, or Gemini from Google. These large models are powering these chatbots, which you and me have access to. To be very honest, if you look at, let's say, the dozen chatbots which are there from USA, France, even China,
Yeah.
Each of them are really good at a certain task.
Right.
And it's not necessary that Gemini will be best at all of them or ChatGPT will be best at all of them. In fact, a lot of the work which we do currently, since a lot of the people who are watching this podcast are clinicians, we look at which of those models are good at what kind of a clinical task which a clinician wants to do. Very interestingly, I can share some results from the studies which we have done in the lab. Discharge summary generation, then natural language generation, in which you are really wanting the chatbot to generate a summary or a complete patient's clinical care pathway, or a history from the existing documents. Claude does very well.
Okay.
It sounds very natural. It doesn't feel at all that you are talking to a chatbot. The same thing, if you look at ChatGPT, a lot of the world knowledge is much more in the newer generation of ChatGPT models, the latest one being ChatGPT 5.
Right.
And that is very difficult to beat in terms of the knowledge and the rate at which they keep on updating that. Similarly, Gemini, we heavily use Gemini and their sister and brother models like MedGemma, which is specifically for medicine.
Yeah.
And for MedGemini, we use them for multimodal data. So if you have a patient, you have a, let's say, an image, a CT scan or an X-ray, and the clinical documents of the patient, you essentially can feed the entire thing to Gemini, and it does a fair job at interpretation. So we, in fact, do a lot of evaluation. The last study which we published from the lab, and it became a really well-known study worldwide, we created a multimodal benchmark for radiology image interpretation, and we showed that where do these models today lie, which is the best model, in which GPT-5 and Gemini 2.5 were doing really well. But the other ones like Claude and all, we're not even getting correct 2% of the cases. So it's very important for us as clinicians to know which model should I go for which task which I want to do. And it's not possible for everyone to try out everything.
Yes.
So we need to come up with our research projects and figure out a leaderboard kind of thing wherein we can tell people that if you want to do this task, choose this model. If you want to do a different task which is of your interest, maybe for you're an ENT surgeon, the models which work for ENT might be very different from the models which work well for radiology, right? So gradually we are coming there. We are doing a lot of evaluation. Government is working on that. We are working closely with the government for evaluating these models. And in the next couple of years, I think the field will be very mature, and we will be seeing a lot of AI models being used by you and me in the clinical practice.
So as I understand it, as of today, there is not one single model which is it's not one shoe that fits all.
Not at all.
So does one kind of learn this also by trial and error? Or how do you know which is the chatbot or the chat engine or the AI module that is best suited for myself? Are there any guidelines or is it trial and error? And as I understand it, a lot of these are paid models. These are subscription-based models. So how many models can you really try before you end up deciding this is the one that I want to use?
This is a very important problem which is actually preventing the adoption of AI today. As a doctor, you really don't have time. We are all like very overworked, right? And we have so many patients. They are our primary people whom we want to care to and treat them. We don't want to spend time figuring out which models to be used.
Right.
So a lot of the work which we do along with government agencies like ICMR and foundations who are looking into the space is to look at the entire landscape of what are the AI models available. So I can tell you a couple of the works which we are doing currently. And often a lot of the work we do for hospitals also, wherein they are interested in using a certain chatbot and they have, let's say, 5 vendors coming to them,
Right.
and they tell ki we really want to know which one should I use. So what we start off with essentially is creating a data set which is very specific to your center or hospital. So we call it local validation. So let's say if you have a clinic today, you will need to have, let's say, 100 or 1,000 patients for whom you have the entire data and you know what task you want to do. So for example, if you have to figure out which is the best ambient AI technology, which means the voice to text transcription technology which you want to use. So you will essentially require 100 patients and the conversations and the final outputs. After that, we do a benchmarking study in which we look at all the different metrics. And very interestingly, it's not always accuracy. Even things like latency, you will not really want to wait for 10 seconds or 20 seconds till the final output comes, right?
Right.
So accuracy, latency, how good they are working in noisy environments. A lot of the OPDs and the hospital environments are very noisy. There are patient attenders coming in. So we look at all these different matrices and create a leaderboard in which we tell that, let's say you are working in a very noisy oncology setup in a primary healthcare center, maybe catering to only the pediatric patients. So for your particular setup, which is the best one? So we are already working on that, creating leaderboards. You will be seeing that coming out in the next year or so. And I believe that will be very helpful for individual clinicians to integrate the AI models as per their setup. A lot of work is happening, and I'm very sure that we will be seeing the implementation very, very fast.
Let's kind of zoom out a little bit, and instead of talking from a very local point of view, can you give us a broad perspective of what is happening globally with regards to AI and medicine? Where is AI already being implemented? Is it being implemented in the reading of scans? Is it being implemented in voice-to-text software? Is it being implemented in interpretation of, say, X-rays? Are we able to generate a diagnosis just by listening to history? So where is globally AI positioned right now as concerned with medicine?
To be very honest, globally AI has become really advanced, and the implementation also has picked up much faster in the countries which already have invested in the data infrastructure for the last couple of decades. If you look at USA, 3 clusters, especially the Stanford cluster in the Bay Area, the Harvard cluster in Boston, and the New York cluster, they have done tremendously well because they had their entire data infrastructure ready since 2005. So they have used those data to come up with really robust models which can not only just do your discharge summary automation, which everyone is doing, or just transcribing the AI texts to a structured output, or let's say the voice input to a structured voice or text output. That's what's happening all across the world, even in India. But in the US and in China, it has really progressed to an extent that they can now predict. So let's suppose you have a patient coming to your clinic or a hospital. You are deciding on a treatment for that patient because of your experience, your insights which you have for the number of years you have seen the patient. These chatbots are now actually acting as a second opinion and telling you maybe this particular data point you did not consider while treating your patient. Maybe you should ask that question. Or it's also giving you a second opinion. Are you sure that these 3 diagnoses are absolutely not possible? So as an experienced doctor, it might not be of that help to you if you're confident about the diagnosis, but we know medicine is very vast.
Before we take this discussion of AI and doctors a little further, I'm going to kind of reverse or completely turn the question to the other way around. I'll give you a small anecdote that happened with me. I have a habit of giving post-operative images to patients sometimes, and I did what I thought was a good job inside the OT. I'd done an endoscopic sinus surgery, and the image that I gave was fed by a patient to some AI bot. And then after 5 days, he came back to me saying that I don't think that the surgical result is really very good. And it was obvious that he was a non-medico, and he did confess to me later on that yes, I did put it into AI, and this is what AI told me. So do you think that when you delve into deeper and deeper into AI and medicine, is it going to be beneficial? Is it going to be harmful? Or like any other technology, it's going to be a double-edged sword?
AI definitely is a double-edged sword right now. You cannot depend fully on AI. You cannot just do away with AI. Your patients previously, if you look at the last couple of years, patients would go back and Google their symptoms,
Right.
and then look at the top few websites and then try to decipher whether what the doctor has said is correct or not. With ChatGPT now, the synthesis of information becomes so easy. They don't have to search the websites. They will just put it on the chatbot and they will ask. And this is happening with patients all across the world. Everyone is using AI models now to see whether their doctor is correct or not. Unfortunately, this often leads to a mistrust which is increasing because the AI models are not at the level of doctors yet. You
Right.
obviously have seen thousands or lakhs of patients over your career, and you have certain insights which is not in the textbooks. You might know that a patient in your community will have gutka or cigarette and might not tell you, but ChatGPT doesn't know that. So he
Right.
doesn't know that what are the diseases which are very likely to be due to the patient's habits. And this is something which is we are seeing commonly all across, is that patients are feeding the discharge summaries, the images to chatbots, and then they are coming and questioning. The ChatGPT is telling that this is happening like this, you must be wrong. So this dependence on trust on AI is increasing significantly.
So if I may just take it back to you again, just as maybe around a decade ago, we learned to deal with Google, and we learned to deal with patients who came back after Googling their symptoms, their diagnosis, their treatment. It's going to be a similar journey for doctors with AI. That today we are
Absolutely,
going to
yeah.
have patients who get back to AI and then come back and question you. So do you think that's going to be a part of our future now?
Absolutely, and I think we really need to up our game with respect to the trust and communication which we are doing with our patients. That will become very important. You never know whether a patient will trust you more or the AI more. And we are seeing a very dangerous trend of patients trusting AI more and more.
Yes.
Because AI does a fairly good job at a lot of other things, not necessarily medicine. We often try to really show it to people that you cannot trust AI fully, and your doctors are much more worthy of your trust than your AI chatbot on your phone. And we do a lot of studies for that. Unfortunately, when you look at these very flashy advertisements and vendor launches which happen, they bring in patients. Recently, a very big company bought a patient during the launch of their chatbot who was asked to ask the chatbot what treatment should she follow because her doctor could not decide. And then they showed in that advertisement that, see, the chatbot is helping you.
Right.
Imagine the effect it has on the patients who are seeing those launches, right? They will feel, okay, then my AI must be better than a doctor.
Right.
And which is not the case. So I think the onus is on us clinicians, also on the government, the policymakers, to really put it out there that certain things are not to be done by chatbots. And if you don't have a certification as a medical AI algorithm, you should really not be doing this, because it just puts us on a very dangerous path of an increasing mistrust in the society, which does not end well for anyone, neither the doctor nor the patient.
Not the patient. Very, very, very rightly said. So I'm seeing a kind of dichotomy over here that on one part we are teaching AI to think like a doctor, but on the other hand we are mistrusting AI because we yet do not know its inherent trustworthiness. So today I feel as doctors we'll have to learn how to live with AI, and of course how to implement AI in our day-to-day lives. Is that right?
There is no other way around. AI today is like electricity. You will have to get used to AI, and the faster you invest your time and a little bit of resources into using AI tools and implement them in your practice, the better suited and ready you will be when everyone else around you is using AI for their
Already
day-to-day
using.
works.
So I'm going to kind of fast forward this to 5 years from now. And now I still remember that when we were medical students, the first thing that our teachers taught us that before you even talk to the patient, you just look at how the patient enters your room, how he or she walks, what is his gait, how do they talk. So half your diagnosis is kind of based on body language and other symptoms which catch the eye before even the patient has talked to you. So 5 years from now, when you have CCTV cameras in each hospital, where you have patients being recorded from the minute they enter the hospital, I mean, can you just paint a scene for me as to 5 years from now, what will, say, a general surgeon's OPD be like with AI?
I will not tell anything which is not happening already. I'll give you a glimpse into the kind of research which is happening. So I work as a visiting researcher at Harvard, and that is one of the top medical imaging labs. I can tell you that we are right now working on algorithms which not only takes into account your images and the EHR data, but we already have autonomous robots doing ultrasound, and we are trying to figure out to what extent these autonomous ultrasound robots can do fair diagnosis on patients for predicting thyroid nodules and things which can be very easily done. Also, we are looking at how can we augment physical examination. So we're trying to see what kind of devices are there which can actually go and physically examine a patient, and how can we use the cameras to do gross capture of the patient's habitus, like you mentioned, as the patient walks in. So it's already happening. It's not that it's like very far into the future. So in 4 to 5 years, definitely we'll be seeing that getting implemented. At the end of the day, our main aim is to help our patients. If by doing that, we can show that those algorithms can help us come to a diagnosis which we might not have thought of, especially in the early days of our residency or just post our MD, if we have not seen that particular case. AI has the advantage that it has seen all millions of cases, right? So that will help you augment. Ultimately, the decision will be yours. When you see this is what my AI is telling, and this makes sense and this does not make sense, because you know your patient the best. You will have to take into account all the data, all the algorithmic outputs which you are getting from the AI model, and then you decide if for your patient this is the best diagnosis which fits it, and this should be the best treatment algorithm which your patient should follow.
So I think that leads us to two different questions that again crop. One question is leading to another, if I may say so. That first and foremost, that kind of gives me a good sense that AI is not going to replace me. At the end of the day, AI may give me enough inputs, it may give me enough data, it may even give me a diagnosis, but whether that diagnosis actually fits our patient or not is something which is finally for the doctor to decide. At the same time, the worrying part for me is that just as we talked about different types of AI bots or engines, unless you are using an AI module which is adequately trained for that particular job, so it's not like you just used any random engine that you have. You have different engines which are directed toward different tasks. So that again will be the onus on us. If I use the wrong engine for the wrong job, then the results will also be wrong. So two takeaway points, if you agree with me. One is that using the right kind of AI will be important for us. And of course, the responsibility at the end of the day will lie with us doctors, right?
Right. I would just add there is that that's the current law of the land.
Right.
Ultimately, a lot of the things change as the regulations and the laws change. As of today, the onus and the liability of any decision you take for your patient is with the doctor. We do not know what happens to the regulations, and the reason we do not know is that India has a huge shortage of doctors. We are already seeing a push of implementing autonomous AI in those areas where doctors are just not there.
Not available, yeah.
So what can we do about those places? If you look at the rural areas, we don't have a doctor even for manning a radiology center, or even the clinics don't have properly trained MBBS doctors to cater to the patient. So what do we do there? So governments are looking at how can we help AI doctors reach to that part of the society which do not have that ability to come to a center like AIMS or a top center of the country. I think that will significantly become mainstream as and more we see that AI is being able to help our patients. So having said that, it's going to take some time because no AI is today able to do that and take the responsibility of 100% accurate diagnosis. That has to be a human being at the end of the day. So yeah, I mean, a lot of interesting things are going to happen in the next couple of years, and it's not just going to depend on technology. It's going to depend on economics, the economic policy of India, and also the AI strategy which the government takes for the next 5 years.
I think the actual cost of AI also. I mean, if the cost of AI is very high, then implementing it is obviously going to be a problem. Now, like I said, one question leads to another. This also brings me to, like you rightly pointed out, a legal issue. I'll give you a few parallel examples. For example, in the last maybe 10-15 years, no country's laws have been able to keep up with the technological advancements. Today, when you have a driverless car and you have an accident, who is responsible? Is it the owner of the car? Is it the company which manufactured the car? Is it the internet service provider where there was a gap and there was no internet connectivity to that car? So today, insurance or even law does not have full answers to this. So similarly, I think that when you talk of AI, today, what if AI misdiagnoses a patient? What if, as a doctor, I depend on AI and I misdiagnose a patient and the patient is able to prove that the fault was with AI? So I think legalities have a long way to catch up, and we will all have to kind of, adapt to the situation as it comes.
Yes, and this is true across the world.
Right.
All the regulators are now really confused. How do you give the responsibility to a machine? You cannot. And there are so many other factors which needs to be taken into play when you treat a patient, that for the foreseeable future, we do not see any AI model without a human being involved. Now, it can be a doctor, it can be a trained person who is an expert in that AI model. That we do not know. But till we have a human being who takes the responsibility as an expert to use that AI model's output to treat a patient, the laws will never allow completely autonomous AI. Right. That being said,
especially in a field like medicine.
Especially in a field like medicine and finance also.
Right.
These are heavily regulated fields, right?
Yeah.
But the evidence which we are generating now, I can tell you a small example. There's a big hospital in India which is already running an autonomous AI model for chest X-ray report generation, which actually does not even send the normal X-rays to a radiologist, but directly gives the report to the patient. It's mentioned that it's by an AI radiologist. So the patient is aware, and if they want a second opinion, they can come and get a radiologist report.
But that disclaimer is given at the bottom.
Yes, and in fact, it's part of a research study.
Okay.
So once these studies are done and the results come out, if you do not know what, I don't want to bias anyone by saying that it will be good, it will be bad. I know what's happening, but once the results come out, that actually will influence policy.
Right.
So if it's showing that, let's say 100% of the normal ones were normal, then government might come out with a rule that, okay, let's use this particular tool for triaging, and only the abnormal ones will be sent to a radiologist. Right? Initially, if you look at chest X-rays and in radiology, it's fine. There are so many chest X-rays which go unreported, right?
Yes.
Thousands and lakhs of X-rays get unreported. It's good for them that at least they are going through an AI. But in the long run, once this becomes widespread beyond radiology, beyond chest X-ray to other modalities, how does it affect the workforce? How does it affect the medical professionals who have been doing this and are just getting cut out from the system because of these models? And this is not something which is going to happen in a couple of years, but rather in 20 years or so. That will be a very tricky time to navigate, but I'm sure we'll figure out
we'll adjust and adapt,
something which works for everyone.
Right. I think all this talk of AI is getting very exciting. Now the first and foremost question that most of our viewers will say that, okay, what do I do? What do I do? I want to have AI in my clinic. So we talked about AI from two opposite points of view till now. One is as an end user who is using an already established search AI bot or engine. Whereas you talked also about using AI to use your own patient data and building up an AI system where it works for your kind of position, your city, your place, your clinic. So what is it going to be? What is easier? Using something which is ready-made as a subscription basis and you can just use it off the shelf, or trying to build up your own database, which may take long and which may have problems of credibility?
It's a process, and you cannot wait to build your own database and then create the model. It's very difficult. I will tell you a very simple way which can help people start off with, and that is what we have seen in the last couple of years works best for the biggest corporate hospitals of India. The first thing is, and I'll give you an example of how we approach it in our research lab. We have 4 verticals. First is building the data sharing infrastructure, which helps us capture the different kinds of data which a patient is coming with, which is relevant for an AI model. Second is evaluating, which brings me back to the point which you were mentioning, that how do we decide which models to use? It's not possible that each and every individual clinic will be doing studies. They don't have the capacity for doing or even buying the API credits for so many models. It's a huge amount of money also. The third is building your own models, which is a very long game and it really will take a lot of time. So how you can start off with is essentially identifying which is that particular task which is most important to you, which is taking a lot of your time and it's very remote and not so cognitively important.
Maybe something which is very repetitive and run of the mill.
Like let's say summarization or discharge summary generation, right? That is something which a lot of the hospitals residents write at the end of the shift, or many of them have typists who look at the entire records and type out the summary. Interestingly, and I'll share an anecdote, in Chennai, one of the hospitals, we had built a discharge summary generation tool called Axon, and once we deployed that, it was generating the discharge summaries to a better accuracy than the existing team of 7 people whom they had, the typists. It was being generated in 15 seconds compared to the 2 hours which was taking to do that. So the patients were discharged earlier and the hospital was saving a huge amount of money because the API calls, and API calls means the money you give to the AI model for giving you an output, that was significantly less than what you were paying for the typists. So it brings an ethical concern that what happens to their job. So they actually did not think of completely doing away with them, but they repurpose them to do other things. So this is going to happen gradually. Once you decide that this is my most important task where I can use AI, you start doing your benchmarking. So what do I mean by benchmarking? You create a data set which is specific to your local setup. Then you run the models.
So Dr. Datta, if I can really take you down to basics, to what a doctor who has literally no background in AI. Today, if you run a small clinic, you see a few patients in a day, you have maybe 1 or 2 staff, you are a one-man army or a one-person show over there. You do everything, right from taking history to examining to writing a prescription. How would AI help such a doctor in his or her clinic?
There are already a lot of AI startups who are building solutions which look at different parts of the patient's journey. As a clinic, the first point of contact which you have with the patient is often when the patient finds out about you. And that's essentially from social media, right? A lot of the content which you generate, be it in the form of text content, your blogs or your reels, everything can be done by AI. And there are specific AI chatbots and AI softwares which can help you generate that. Few of them are paid, few of them are also free. So you can just play around with them and figure out what works best for you. Secondly, when the patient is coming to your clinic, the scheduling part, The scheduling is a very repetitive task which can be done by an AI chatbot for your particular clinic depending on your availability. And you don't need to really go and select slots, but now just talk to the chatbot. I am available at this time. Whenever the doctor is available, let's say from 2 p.m. to 4 p.m. on a Saturday, I want to book a slot which is available, and it does it for them. So if your clinic gradually is becoming AI integrated, it also helps your patient a lot, because the entire time which is spending to find you, to interacting with the very traditional software which you have, that saves his time and makes the patient experience much better. Even then, let's suppose you are seeing a very busy OPD. You are not able to give a lot of time to your patients. And if you look at the statistics, it's around 5 to 7 minutes on average, which you are able to give the patient also is unsatisfied. But if an AI chatbot can take care of your entire history of the patient, and it not be a very granular history, but the demographics of the patient, whether he's a drinker, a cigarette smoker or not, what are his habits, what is his old history. He can just take a picture of the old records which he has, and then the AI module converts that to a patient care pathway and gives it to you. So before that patient enters your clinic, the AI module already has entire details of the patient.
So as I understand, even in a small clinic, certain repetitive tasks like history taking, for example, scheduling of appointments, can be taken care of by AI. Taking it forward, can the same be implemented to smaller hospital setups or nursing homes, where again, shortage of manpower or shortage of skilled manpower is usually the problem? So what kind of tasks, say in a nursing home setup, do you envisage AI taking over?
A lot of the smaller hospitals already have started implementing EHRs and EMRs. In India, almost 10% of the hospitals today, or even less than that, have truly digital data. So 90% of the data of your hospital is just getting lost. They are all in your notes, handwritten documents. So at the end of the day, in AI world today, a large amount of your leverage comes from the data of the patients which you are seeing. So AI can actually help you in digitalizing that. So first, obviously, is the patient who is coming to your hospital, the entire workflow which a patient has to go through, from getting a appointment, scheduling, and finally the initial clinical history, which an AI is anyway doing. Alongside that, you are also able to record the patient conversations and structure it in a digitally recordable way, which you can later use when you are trying to get AI modules for specific purposes. I'll give you an example. It's very difficult for you to convince all your doctors in your hospital to suddenly move from pen and paper to typing.
Yes.
It's just not possible. It takes a lot of time, and the incentives are also not just enough.
And there's a learning curve to it again.
Absolutely. Yeah. And that leads to a lot of increased stress, which has been seen in the US as well when they try to do that. For India right now, we are at a pivotal point. You can just keep an ambient AI tool which listens to the conversation between you and your patient and gives you an output exactly like you want it. So it will also give you a summary. It will also give you a structured output, an Excel file with the symptoms, the treatment you suggested, and even the drugs which you suggested. So this helps you in digitalizing the entire record of the patient without you needing to do anything extra. You are anyway doing your handwritten prescription for the patient, but the same data you are getting recorded in your...
Parallelly getting digitized.
Exactly. Without you spending any extra time.
Okay.
So this will help all the smaller hospitals to actually start getting digitalized. And this will be hugely beneficial in the next 4 to 5 years when you actually start implementing AI tools and creating your data sets to see which is the best AI module which works for my setup. Now, when the patient goes also, you often have a huge amount of leakage. If the patient is going to, let's say, some other place for getting the diagnostics or for getting your drugs. An interesting startup previously in the AI space, what they did was, the moment your digitalized input and output, they go to the servers of your hospital, your pharmacy and the diagnostic service gets a nudge, okay, this is being recommended, and then they contact the patient immediately that if you are coming, this is the slot which is available. And so the patient would be going to those places only and not go back to his home and then get from some other place. So that leads to an increase in revenue.
Right,
and
right.
we have seen in like 2 hospitals at least, it has been seen right from the second month, an increase in revenue due to a decrease in the leakage of the patient. So these are the immediate things which I can see hospitals can start doing right from day one.
Now, it's important that you talked about leakage, though in a very different reference point. What about data privacy? Are there any legal or other implications when you use AI? How important is data protection when you come to usage of AI in your practice? And is that a concern today?
Absolutely. In fact, like I mentioned, anything to do with the patient, which is having the history of the patient, the medical records of the patient, or even the conversation, you have to get patient's explicit consent. So there is an act in India called the DPDP Act, which has come out recently, which mentions the guidelines which you should follow when you're dealing with patient data. There are some clear-cut guidelines that you actually cannot send your patient's data outside the country unless approved.
Right.
If you look at ChatGPT and Claude and Gemini, they are all sending to US servers.
Right.
So this becomes very difficult and tricky for you if someone finds out that you are using ChatGPT for sending that data outside, and by chance it has the patient's name or anything
Mobile
which
number,
identifies.
it could be anything,
right?
address, for example.
Yes.
Yeah.
So you cannot do that. The way people bypass this is essentially by hosting it on the Indian servers, which again becomes difficult because not all doctors have access to a good IT team which can do that. But I am sure that as the laws become more clearer, we will be able to do that in a consented manner, but we have to be aware of what is the law of the land.
So are you trying to tell me today that if I'm using AI in any form in my clinic, it's better and advisable to have some kind of a consent in place?
Absolutely. It's not
One should.
advisable. You have to.
Mandatory.
It's mandatory to have a consent in place, because most of these chatbots, especially the free ones, they use that data for training their algorithms.
Right.
So you will be in a soup and a legal trouble later if somebody finds out that you are sending all the data to a server outside India. It's not even allowed actually, to be very honest today. So that is the reason why you're seeing OpenAI and Anthropic building India offices.
Right.
Google spending so much money to build data centers in India because they now want that Indian data should stay within the country.
So they're trying to conform to the legal
Yes.
practices which are allowed in India
Yes.
today. So I think that's very heartening for all of us to know. But now I'm going to put a totally different kind of question to you. Are there any ecological concerns with AI? It is something which probably very few people give a thought. You just upload a photo to some maybe chat GPT and get it converted into something else, and we are all happy and doing our own social media thing. This is something I just read off the internet, correct me if I'm wrong, that the amount of energy it takes to edit one HD quality image is equal to the electricity that is used to charge one iPhone, is what I've read online. So are you up to scale with the ecological concerns that are there with usage of AI? And do you really think that one should really put one's mind to it?
We have to do that, not just because of environmental reasons, but also because of how it's going to affect us. If you look at the enormous amount of money and resources being put into building the data centers, they need a huge amount of electricity. They need a huge amount of water
Clean
for
water.
cooling.
In fact, potable water is used, is what I've read.
Yeah. And we just don't have that ability to sustainably provide these two for the data centers. I'll give you an example and an anecdote actually. The places where these data centers are being built now, because of the electricity demand, the adjacent domestic areas are now having to pay a very high electricity bill because the cost per unit has tremendously increased.
Yeah.
So these are small economic effects on the people also, which gradually come up when we are building data centers, which require a huge amount of electricity. Along with that, obviously, water usage and the amount of conventional resources which were used, right?
Yeah.
It's going to harm the environment also in a way. And we just do not have figured out how to build this sustainably. There are laws coming up which is mandating these big companies who are building the data centers that whatever energy or whatever ecological effect is having, you have to create a similarly commitment to increasing the greenery and the environmental cause by either planting trees or getting a forest and improving the greenery of the forest. So these mandates are coming in.
So it's just like reducing your carbon footprint as
exactly.
It,
that's
for
the
every
exact
other
term
industry.
which is used.
So I guess the point that we need to understand over here is not to use AI frivolously. I mean, it is something which is useful, which is a part of our future, but using it frivolously doesn't really make ecological and economical sense both. If you had to give one message, just one brief message to every clinician or every paramedical person or anybody who is listening to this podcast about AI in medicine, in brief, what would it be?
There are two kinds of audience for this podcast today. One would be the young doctors or even medical students who are seeing this. Do not depend on AI because we are seeing studies coming out from different research groups all across the world that if you are getting dependent on AI during your training, you fail to develop certain skills which becomes really important for you.
So Dr. Datta, there's an internet meme which is going around that AI is never going to replace doctors, but doctors who use AI are definitely going to replace doctors who don't. How far do you think it is true today and tomorrow?
I think it's a very cliched line which everyone is using nowadays without even understanding what it means.
Yes.
Some things are very obvious that you cannot live without electricity or water today, right? So AI is just like that. It's going to become a part and parcel of the medical fraternity and the humanity as a whole. So everyone will use AI. What will matter is that how good you are at using AI, how well you know the limitations of AI tools, so that you are well aware that, let's suppose you have a AI tool, and there it's a like true story actually. One of the AI softwares which detects chest X-ray diseases, they are really bad at detecting clavicle fractures.
Okay.
So as a radiologist, when I'm looking at the AI output, if I'm seeing 100 scans per day, if I know that this model doesn't pick up fractures, especially clavicles, well, I might just neglect that. Mm-hmm. But if I really know that this is a problem with this tool, I will look at that area and pick up the fractures.
Right.
This prevents medical legal cases later, and it protects you as a doctor, but also it makes your diagnosis and skills highly valuable as a physician. So this is the particular skill which will be very, very important in the coming years, is that knowing the AI tools, which AI tools works best for your practice in your local setup, and what are the shortcomings where you can come in as an expert and figure out that, okay, AI is going wrong here, let me come in and correct the diagnosis.
I think that's very, very well said. So Dr. Datta, we all know that you started off as a radiologist, but now you've transitioned completely from a radiologist to a person who is immersed himself in AI and medicine. Could you briefly tell us about this journey of yours?
It really started almost 10 years back. I was a medical student at JIPMER, and we were essentially trying to figure out how can we predict secondary outcomes and compliance in tuberculosis patients. At that time, AI was not so fashionable or common, right? But we looked at what are the best possible statistical models, and machine learning models or AI models were the best at doing that. That was my first introduction. But when I was working with this team in IIT Madras, I realized that it completely changes the way we are practicing medicine. I decided that this is something which really fascinates me and interests me. And also I'm like fairly good at mathematics and physics. Mm-hmm. So I thought that this should be the area which I should be looking at. In fact, that was a reason why I chose radiology. And when I joined AIMS Delhi, the first project which I proposed to my guide and my HOD was a AI model development project. it was not done before in India, and so everyone was skeptical. But after a lot of convincing, I finally convinced them to let me do the thesis project as a part of my MD. And we worked with IIT Delhi initially, then IIT Jodhpur, to build India's first 3D foundation and 3D machine learning model for not only detecting and classifying fractures in ribs, but also prognosticating patients so that we can tell the surgeons that your patient has a more or higher risk of going into complications. That was a game changer for the field, and we got a lot of international awards and recognition. That, in fact, put me in touch with a lot of people who are working in core AI research. I was doing part-time AI research during my residency, but then Dr. Anurag Agarwal, who is one of the most well-known physician scientists of India, he offered me to do full-time AI research at Ashoka University. So I joined Ashoka this year, and I set up a lab. And my lab is called the Center for Responsible Autonomous Systems in Healthcare, or CRASH Lab. Before setting up, I had worked with Pranav Rajpurkar at Harvard as a visiting researcher, and I saw that there was a huge gap in the way research is done in the US and in India. So the idea for the lab at Ashoka is to help clinicians like you and everyone else to work very strongly with AI researchers and engineers to build workflows which fit your problems. Not like technical people are coming and giving you some solution and you are using that. So we work very closely. It's a 60-member strong lab, and few of the most impactful projects which we are currently doing. One is building foundational models, but most importantly, and whose impact we see is going to happen in the next few years, is that we are working with ICMR and a lot of other agencies to really do a large-scale evaluation of AI models. One is with the ambient scribes, which converts doctor-patient conversations to a digital record.
Right.
And we are looking at the entire landscape of all models like ChatGPT, OpenAI models, Google models, but also Indian models and Indian players who are there in the market, so that as a clinician or as an EMR or EHR player, if you have to choose which is the AI tool for voice conversion, I need not spend money for evaluating that. They can just go to our leaderboard and see, okay, for my particular setup, this is the best one. And the second one which we are doing, and it's a very ambitious project, almost $1 million were put in for this one, is looking at how bad or how good the existing frontier models like ChatGPT and Gemini are at answering medical question answers. So this is a very large national project which we are doing. You will get to know very soon in the India AI Summit about it, in which we are doing a complete landscape analysis of how these models perform in the Indian setup. So these are the two most interesting ones. But along with that, we are also developing newer architectures. Like Transformers architecture is something which GPT does, but we strongly believe that India should have its own architecture. So we are developing that with IITs. We're also working with Stanford for doing really large global benchmarking with NUS for the foundational models. And with Harvard, there is an upcoming project which is coming up for something really interesting, which you'll get to know in the next couple of months.
And from here, we'll take it to one of the more interesting parts of our conversation. We are going to do a nice rapid fire round with you.
Sure.
And thanks to Top Tails, we have a beautiful hamper waiting for you at the end of it.
Oh, I'm excited now.
And I'm going to put out a disclaimer over here that neither the questions nor the answers are AI generated. They're truly human down to the core. So let's start the rapid fire now, Dr. Datta. AI in one word.
Magic.
A medical specialty that you think is going to change the fastest with AI. And I know that you're a radiologist. So that answer is out.
Diagnostics.
That's a very political answer.
Yeah, but it is the truth.
It is. One AI tool that every doctor must explore.
Claude. Because ChatGPT everyone already does, but Claude you should definitely explore.
One human skill that AI can never ever replace.
A year back I would say empathy, but today I would say your microsurgical skills.
As an ENT surgeon, that's very heartening. The biggest myth about AI in healthcare.
There's a lot of areas where AI has already surpassed human beings we are not aware of. So it's no longer a myth that AI is subpar with humans, but it is outperforming us in many of the tasks.
The next big AI breakthrough that we are likely to see in the next 5 years.
Quantum AI, and we are already seeing the quantum mission happening. It will put India at a very top stage.
Okay. Just one line to doctors who are still hesitating to use AI.
If you really hesitate to use AI and do not incorporate AI in your practice, then your life will become very easy because you will not have patients anymore.
The one most exciting AI project that you yourself are involved with or are following right now.
The most impactful one which I am doing right now is to build India's first chest X-ray foundational model.
Okay.
And that is our moonshot project, which we are currently doing.
Fantastic. If AI had one superpower with regards to medicine, what would you wish that to be?
If AI could be actual human physical doctor, then I think that would be the best physician who would be existing in the world.
The one AI application you wish existed today, but yet hasn't seen the light of the day.
Again, I'll be biased because I'm a radiologist. I would really want the interventional radiology robots to come out and help us, because it takes a lot of time for us to figure out the fluid mechanics of the body, which we know that AI does fairly well, but has not happened yet.
Yeah. And lastly, I need your prediction just in one line again. How do you think AI is going to change the life of a doctor, maybe in the next 3 or 4 years or 5 years?
It will initially frustrate you, but by the end of 5 years, it's going to make your job much more easier, more efficient, and also more productive than it is today.
So I think that was a fantastic round of rapid fire questions, spot on, witty, to the point answers. I think you're the rightful owner or recipient of this beautiful hamper that TopTales has bought out for you.
Thank you.
I think we've had a very insightful and very thoughtful TopTales episode about AI and its role in medicine. I would like to thank Dr. Datta for his insights and his guidance in the same. Few key points that came out for us today was that yes, AI means it's not man versus machine, but AI means it's man with machine. AI is not here to replace doctors. It is here to augment doctors' capabilities. AI is never going to overpower you. AI is going to empower you. And as again, we have to wholeheartedly embrace this new technology and use it to augment our practice rather than look at it suspiciously. And I bring a close to this another episode of TopTales, a podcast with a difference, a podcast which helps to enrich medical lives and their professions. Thank you.